Hello and welcome to another episode of Heart Trending. Today we're going to talk about leg swelling. Leg swelling is the most common complication come to the primary care as well as to the cardiology clinic. Usually the patient complain of swelling in the feet all the way to the knees, and they are chronic and build up over time. Usually the patient complain about heaviness and pain at the end of the day. Most of the people who have these complaints are those who have professions that require standing all the time. People who work in assembly lines, barbers, teachers, and any other profession who require you standing a lot or sitting a lot. The reason for leg swelling can be summarized in three main reasons. One, due to venous problem, meaning the system that brings blood back to the heart is usually lazy and dilated and not able to keep up to bring back the blood to the heart. This is called varicose veins, or in other terms, venous stasis. Usually the patient complains of heaviness, as I mentioned earlier, and in advanced cases, usually there is ulcers as well above the ankle. So how we can prevent this from happening? One, by walking frequently during your shift time or on your break time. Two, compression stockings that require you to have 20 to 30 millimeter of mercury, that over-the-counter prescription, or a doctor can write it out for you as a prescription. Three is to stay away from salt or minimize the salt intake. But as I mentioned earlier, moving a lot is the most prevention. The second cause for leg swelling could be due to heart condition. This is what's called congestive heart failure. This is when the heart not able to pump as strong as it should be to push the blood forward and also bring it back to the heart, or because the heart is stiff and unable to dilate and accommodate enough blood. Regardless of the etiology, but it is congestive heart failure that make the legs swollen. Usually these patients has to be on water pills, and they have been prescribed by cardiologists if they have an advanced heart failure that require more than water pill to control that swelling. The third one, which is also more frequent but also most of the time is missed, is clots in the legs, especially when you have a swelling in the leg that is unilateral, or the right more than the left, or the left is more than the right. And usually these patients come to the emergency room because of cramps or pain in the calves, and because they have a long trip, either a flight or driving for long distance, and they have been sitting for a while. That create the blood to stay in the legs for a long period of time, and that will be kind of an environment for clots to develop. This is an emergency, and patient has to go to the emergency room to be evaluated and started on blood thinner if the ultrasound confirm that the patient has clots. In worst cases, these clots can travel to the lung, causes what's called pulmonary embolism or clot in the lung. These sometimes can be lethal. I hope you enjoyed this video. Please watch these videos and other on Heart Trending. I am Shadi Reyes from Detroit Medical Center.